Update about the measles outbreak in the upstate. Following her presentation, she'll take some questions from reporters. Dr. Bell, I'll turn things over to you.
Hey, thank you, Casey, and good afternoon, everyone. On Tuesday, the South Carolina Department of Public Health reported 89 new cases of measles in the state since Friday. That brings the total number of cases in South Carolina related to the upstate outbreak to 789. There are currently 557 people in quarantine and 20 in isolation. The latest end of quarantine for these is February the 19th. Based on the new cases, DPH has identified public exposures at the following schools: Dorman High, Inman Intermediate, Inman Intermediate, and New Prospect Elementary in Inman. The number of students from these schools to be quarantined is still being determined. Additionally, students remain in quarantine from 20 other schools. In all, there are 335 people in quarantine across those 20 K through 12 schools in the upstate. On Friday, we launched a measles dashboard, which can be accessed via our measles outbreak webpage. The new dashboard features additional data, including cases by county and confirmation week. The majority of cases, that 756, were located in Spartanburg County, with adjacent cases in nearby Greenville, Anderson, and Cherokee counties. And while complications are not reportable to DPH, we have learned that 18 people have required hospitalization for complications of the disease since the beginning of the outbreak in October. Some of these are adults and some are children. These are complications we hope to prevent by increasing vaccination coverage. Of our 789 outbreak-related cases whose vaccination status is known, about 95% of them are unvaccinated. And while no vaccine offers 100% protection against infection, the MMR vaccine is one of the most effective vaccines in preventing infection. It's been shown to provide lifelong protection against measles in about 97% of the people who receive the recommended 2-dose series, and booster doses are generally not recommended. The MMR vaccine has a long track record of preventing illnesses, and this means it's keeping communities open and people free to do the things that they need to do and enjoy doing. For example, if an unvaccinated student is exposed to the measles, they must quarantine for 21 days. And that's a lot of time to miss from school activities and time away from friends. However, those quarantine measures are also what has limited ongoing spread in any school setting so far. For the vast majority of South Carolinians, the benefits of vaccines far outweigh the rare risks associated with them. So one way to look at the vaccines is to consider them as a shield, that you control the door that helps stop measles from entering your body, rather than letting the virus harm you, letting it harm someone else that you care about, or letting it harm others. It is our means to control this outbreak. As I've noted earlier, we're starting to see more cases in counties adjacent to Spartanburg. And so it's important to remember that the virus doesn't observe administrative boundaries. It can infect anyone who's exposed. The difference in the risk is the people who are vaccinated are largely protected. So people who are not vaccinated can get very sick and can also unintentionally pass it on to their children, to their parents, to their neighbors, to fellow church members. What happens is that someone who is infected can have early symptoms of the measles and not know it. They go shopping, they go to the movies, they go to a gym, and then they potentially can make others sick without even knowing that they're infectious. So this is the main reason for the need for that protection from the vaccine prior to exposure. And just a reminder that the MMR vaccine is widely available at many primary care providers' offices and pharmacies, at DPH Health Department clinics, and many children can receive the vaccine at no cost to the family through the VFC, or Vaccines for Children program, or through coverage by their health insurance. So as we continue to watch this daily surge in cases in South Carolina, DPH strongly encourages those who are not protected to take advantage of this opportunity to get protected against unexpected exposures and illnesses now, and help us stop this outbreak and protect our communities. And with that update, Casey, I'll turn it back to you for questions. Thank you.
Thank you, Dr. Bell. And for folks who are attending their first briefing, we ask that you raise your virtual hand and we'll call on you in the order in which you raise your hand. If you don't mind asking one question at a time, that way we can get through everyone's questions. If you have additional questions, you can always re-raise your hand to rejoin the queue. But we'll go ahead and kick things off with Erica.
Hey guys, thank you so much. This is Erica Edwards with NBC News. Dr. Bell, thanks very much again for holding these briefings. I'm wondering if first you can just sort of address the magnitude of this milestone that South Carolina unfortunately has met, becoming the largest outbreak in recent history. And then I wondered if you could also speak a little bit more about what's involved for your staff regarding quarantine. Do you contact them daily? What are those conversations like? Do you offer vaccines, that kind of thing? Thank you so much.
Okay, I'll try to get to your questions in order. In terms of this milestone, once measles transmission began in our upstate area, we were very concerned at DPH about the possibility of spread given the low vaccination coverage in the upstate. And at that time, we actually raised alerts about the potential for ongoing transmission. And however, at that time, and as the weeks have gone on, we did not anticipate that South Carolina case counts in a matter of only 16 weeks would surpass the total number of cases reached in Texas over the course of 7 months. So this is a milestone that we have reached in a relatively short period of time, very unfortunately. And it's just disconcerting to consider what our final trajectory will look like for measles in South Carolina. When we think about what the outbreak looked like in Texas, for example, that occurred in a pretty geographically remote area, that was the focus of Texas's outbreak. And by comparison, South Carolina is very geographically compact. And so without better vaccination coverage to achieve herd immunity more widely, we can anticipate that many more susceptible people will contract measles in South Carolina that will continue to see spread potentially to other areas of the state to anyone who's susceptible. So that having reached this milestone, these are the things that we have under consideration and we're urging other people to consider. I think your other question was about how we monitor people who are in quarantine. And we ask people to be in quarantine because of the possibility that they could incubate out and develop symptoms, and those early symptoms may not be recognized. The shortest incubation period is usually 7 to 10 days, so people can start getting a cough, a runny nose, and not know that that is an early sign of measles. And that's why we recommend that people stay in quarantine and do symptom monitoring. We ask that they report to us on a daily basis if they develop any of those early symptoms. And if we don't hear from people in quarantine, we actually take measures to call them directly and ask them how they're doing so that we have that symptom monitoring program set up. I believe you had a third question. I'm sorry, I don't remember that.
Thank you so much. I was just curious whether you're offering these folks vaccines while in quarantine, and then how long do you wait until you hear from them before you reach back out?
Yes. It's important for us to learn of exposures as quickly as possible, because if people can get vaccinated within 72 hours of exposure, that can prevent infections and they can avoid quarantine. We do recommend that people can still be vaccinated in quarantine, but that does not prevent infection. So this just means that they could potentially avoid a future quarantine. And for your final question, if we ask that people report to us symptoms daily, and if we don't hear from them within about 2 days, we give them a call and find out how they're doing.
Thank you, Dr. Bell. And next we've got Teddy. And as a reminder, if you don't mind just asking one question at a time, that way Dr. Bell can, remember all your questions, and you can always re-raise your hand if needed. Teddy?
Hey there, thanks for taking my question. I'm Teddy from the New York Times. I had a question about the cases that we're seeing in North Carolina. It seems like there are about a dozen now, and I wondered if they had been officially linked to what's going on in South Carolina and whether this is sort of officially a multi-state outbreak.
No, we're not calling this a multi-state outbreak, and I'm sure that North Carolina is doing the same case investigation and contact tracing as we are, so I can't comment on the association between the cases that they are currently investigating in terms of their linkage to South Carolina. But at this time, with these, we're not reporting ongoing transmission from state to state, so we're not calling this a multi-state outbreak.
Thank you.
Thanks, Dr. Bell. And Tom?
Hi, Tom Corwin, Post and Courier. I'm curious about how many folks you have now doing contact tracing, because it looks like just over the last 3 weeks, you have more than 575 cases, something like an average of 27 a day. And I'm wondering how many folks you have who can take that on.
Yes, we've actually previously reported on the total number of staff we have from various areas of expertise who are supporting this outbreak response. So the actual number of those who are doing the case investigation and contact tracing, that's the largest proportion of our response staff. I don't have that actual figure for you now. But it is a tremendous workload, and for those frontline staff, what it means is that we're reaching out and appreciate the cooperation of people who are answering our questions to learn about when their symptoms began, where they might have been, to assist us in investigating this throughout the community, so we can also learn about public exposure. So that work is really critical and really important, and we have a large number of people who are working on that. And we have a large number of people, as has been reported, that we have to follow up on with the number of exposed that we've identified.
Thank you.
Thanks, Dr. Bell. And Deirdre?
Hi, this is Deidre McPhillips with CNN. Thanks for hosting this. I was wondering, we understand that HHS has provided, or they're working to provide $1.4 million in funding assistance for responding to this outbreak. And I was wondering if you could talk a little bit about plans to spend that money.
Well, we receive federal funding through various funding mechanisms, through a variety of grants that are designed for support for immunizations, for clinical services, for emergency preparedness. And so the funding streams come through different channels and have different criteria for how we can use that funding. But in terms of for this outbreak response, where funds are allowed to be used to support personnel, to support supplies and resources, to support vaccinations, that is both people who are administering the vaccines and the vaccine products themselves. So that's just a general overview of how we receive federal funding and how we must adhere to the requirements for how it can be spent. We carefully budget that money, and it's been very beneficial to our response so far.
Thank you, Dr. Bell. Carrie? And Carrie, you might be muted if you're talking.
All right, can you hear me now?
Yes.
This is Carrie Beal with Fox Carolina News. I had a question, with all this weather hitting us and schools being out, do you think that we might actually see a lull in cases maybe next week or the following week because people haven't been in school as much? We're supposed to get more snow this weekend, so school might be closed again Monday, Tuesday next week. So just wondering if that might be a little light at the end of the tunnel.
Not necessarily. It depends on people. It depends on what people do while they're not in school. So those school closures, as we look back at what happened during the holidays when people were not in school and they were out and about in the community, enjoying recreational activities and things like that. And for those who had been exposed, and as I mentioned earlier, may not know that they're carrying the virus and spreading it to others. So the impact of the weather, we simply cannot predict what that will mean. But when we think about the incubation period, we will look out from 7 to 10 days from now as long as 21 days to see how this might have impacted us with a retrospective look.
Thanks, Dr. Bell. And Lena?
Hi, Dr. Bell. It's Lena Sun from the Washington Post there. Thank you very much for doing this briefing. I was wondering if you could talk about, given where we are in the outbreak, that it's not over and maybe hasn't even reached its peak, what are your thoughts about outreach, more mobile clinics? The vaccine uptake has not been great. Changes in strategy to try to boost vaccination?
Certainly. I mean, that encouraging vaccination and the protection that it offers is a focus, obviously, of what we want to achieve, higher vaccination coverage. But how we achieve that and sort of understanding what leads to hesitancy to getting that protection is what we want to continue to understand. And we do this through outreach in various ways. So we are continue to work and intensify our efforts to connect with community spokespersons, community leaders, those who are trusted, working with the faith community, faith leaders as possible, working with community-based organizations and community health workers who are who work within the communities and are most familiar with those groups, perhaps most trusted by those who are most impacted. And then our messaging is very important. We want to make sure that when we hear about myths or misinformation, that we put out science-based, evidence-based information about how the vaccines do work, what they do and do not do. And so all of that, the messaging, the outreach, and the promotion of the vaccination services are the pillars of our response. In terms of those mobile units, we know that uptake was not necessarily as high as we'd hoped for each of those various clinics, but we do know that uptake in other settings is important to pay attention to. So when we make people aware that you can get a vaccine at a local pharmacy or in a clinic, those are other options, and we are monitoring that as well. And we are seeing increases in vaccine uptake there, not as rapid as we'd like to see to do that catch up, because we're coming from behind from all those percentage points that we've lost from that herd immunity that we want to achieve.
Thanks, Dr. Bell. And Ann Thompson?
Thank you, Casey. Hi, Dr. Bell. My question for you is, why is this concentrated in Spartanburg County? Why does it have such a low vaccination rate? And what are you up against in trying to convince people to get vaccinated? Thank you.
Well, the concentration in Spartanburg County is, as I mentioned earlier, that we understood that vaccination coverage there in that area in Spartanburg County, in many of the schools in that area, is lower than in many other areas of the state. And so by comparison, people in other areas of the state with higher vaccination coverage are better protected. That's why we see more ongoing transmission completely predictably in an area of lower vaccination coverage. Why that is, I've spoken about this before. We have people making individual choices and have different reasons for vaccine hesitancy, vaccine resistance. And in our outreach efforts, we're trying to learn about those various reasons that people have for questioning the success of the vaccine historically, questions about the risks associated with the vaccines. We remind people of the very serious risks of the disease itself that people forget about as we look at more and more hospitalizations. That is part of our messaging, that there are severe complications from the disease. And so those are just a mention of how we're working to address this specifically in that community that is under-vaccinated.
Thank you. And Eduardo?
Hi, Doctor. Thank you. Eduardo Cuevas from USA Today. I wanted to ask, what do we know about the source of the outbreak? As I understand, the measles virus variant's consistent with other outbreaks in the United States last year. What does the variant tell you about the outbreak's origins? Thank you.
So the genotyping that they're doing on the measles virus specimens that they're collecting nationwide demonstrate that there is a great deal of similarity in what's circulating in all of the outbreak settings in the United States. What we need is actually the epidemiologic evidence and that piece of the investigation to help us identify the source, because without a significant variation in the genotyping from one site to the next, when we try and identify the sources, it is the investigation of where people have been, who they may have been in contact with. That is, in the short term and in the immediate response term, much more useful to us in terms of potentially identifying the source. The genotyping takes quite a long time to get the results from that back, and it's a different kind of analysis of the source of the virus compared to settings in this country and in other countries. So what that genotyping tells us is not the greatest measure without the epidemiologic evidence to tell us about the sources.
Thanks. And Leanne? And I'm not hearing anything, Leanne.
Hello? Hello?
I hear you now.
Hello? Okay, sorry. So Dr. Bell, I'm wondering if you can address school vaccine exemptions, both medical and religious. Can you tell us a little bit about the process for approving those, and what do you think might be changed and might have contributed to this low vaccine rate in this area, in both private and public schools, please?
Yes, we have our requirements for our immunization requirements for school entry. Exceptions to those requirements are allowed by a medical exemption, which is if someone has had a reaction or has a medical indication for not receiving usually a particular vaccine. Someone can also get an exception if they are in catch-up, if they've transferred for another area and they're waiting on their records, and so they get an exception while the records catch up that document their immunization coverage. And then there is a religious exemption that can be obtained through one of our county health departments or online, where the parent or guardian will attest to them having a religious objection to receiving vaccines. We try and counsel those parents about the consequences of making that choice. And we also advise them that while they can get a religious exemption, if there is an introduction of an infectious disease in the school, a vaccine preventable infectious disease, they sign off on the understanding that their child must be exempted, excluded from the school setting if they have that religious exemption. And so, and that's the process for getting those exemptions.
Thank you, Dr. Bell. Jessica?
Hi, this is Jessica Nix from Bloomberg. Thanks again for doing this today. Similar to Lena's question from earlier, since it sounds like this outbreak is not slowing down, can you speak to how the state has changed tactics to try and bring the outbreak under control? And have you called for additional help from the CDC?
The tactic for control is really the same. It is protection through vaccination or by containment when we are aware of people who are infected, to keep them from infecting others, to isolate them during their infectious period, and to quarantine people after they've been exposed. So the principles, the disease control principles remain the same regardless of the number of cases. It obviously becomes much more difficult the more cases that we encounter, but that doesn't change the principles of the disease control. So we continue with those measures. We have not requested support from the Centers for Disease Control and Prevention because we are using staff that we have, our existing staff, a staff that we have hired on for a temporary purpose to help us with the response. And the response is the same. The messaging is the same. The outreach is the same. It's just the scope of this outbreak is what we hope to see us soon on the downward side of this. But we can't predict that now with the number of people that we currently have in quarantine. When we think about the number of people previously in quarantine who incubated out and developed disease. That's what we're keeping our eyes on. And so what we see ahead of us is still a large number of people who have been exposed, a large number of people in quarantine who may incubate out, and we're not seeing that slowing at all yet.
Thank you, Dr. Bell. And that question about the CDC touched on one that we had in the chat box. Tyler, I think that was your question. If you have any follow-up, feel free to respond in the chat box. Next question from Jen.
Hi, I'm Jen Kalfas from the Wall Street Journal. I guess I just wanted to follow up a little bit more on that question about the outreach to the CDC. Why hasn't the state reached out if we're kind of seeing the acceleration at this level, and what kind of support could the CDC provide should the state reach out? I'm just curious if there's like a line that must be crossed in order to warrant something like that on your end, or kind of what's the reasoning behind not having and seeking that assistance quite yet.
So we are receiving assistance from the CDC through subject matter expertise and that kind of technical assistance remotely. I thought the question was referring to, have we requested the CDC to send a team of people on the ground in South Carolina? We have not requested that kind of support. The reason being is that we have shot givers here in South Carolina. And so the assistance that we could gain from encouraging people to get vaccinated, which is one of the primary disease control methods that we have, is if people are not turning out at high levels to get their shots, then that is not something that we necessarily need CDC assistance for. The case investigators and contact tracers, we have people who are helping us to make calls. These are people who are sort of frontline workers. We do not require the expertise of the CDC to help us staff a call bank and things like that. So the type of assistance that we need is what we're actually covering here on the ground. It doesn't mean that that the surge in cases could be controlled by additional CDC assistance, because the outreach, the direct connections with the impacted communities by people who are from the community, who know the community, is also not something that the CDC could necessarily support, as we're working to work more directly with the impacted community. That external support is not supportive of that either.
Thank you, Dr. Bell. And I'm going to get to one that's in the chat that's been there for a while. And it's Debbie from AP. She asks, Dr. Bell mentioned the spread has been prevented in schools. In what community settings are you seeing spread in that case? Is it in particular communities or in the general public?
Most of the spread that we're seeing throughout this outbreak has actually been within households. So those close household contacts and other close contacts is that kind of transmission. We have not seen ongoing spread in the schools because that's an environment where we're able to get the vaccination histories, get the vaccination records, and exclude people from that setting and those congregate settings who could potentially spread to others. We have seen churches as important settings of transmission where, people are sitting together and they're participating in church services for prolonged contact of an hour or two at a time when they're in a church service with people. We have seen transmission associated with exposures in healthcare settings, and we have continued to encourage healthcare settings to take measures as they evaluate people who present with symptoms of respiratory illnesses to put a mask on people who present with those symptoms that could be an indication of early measles infection. Isolate them from waiting areas where other people might be exposed. Make sure that your workers, not just the healthcare workers in those settings, but administrative staff and other people who are in those settings doing intake, are vaccinated, because we are having to track a number of workers across disciplines in healthcare settings who have been exposed. And so when we track exposures in the community, with the number of public exposures, we also sort of lose track when there are multiple places where people could have been exposed. And so that is the main sources of transmission that we've looked at. I'll just circle back to the fact that it has been close contacts in households, in church settings, and those kinds of congregate settings.
Thanks, Dr. Bell. And Tyler, who asked in the chat about the CDC, had a follow-up. He says, while South Carolina is working tirelessly with numbers rising in spite of that, wouldn't more support always be welcomed? Wouldn't CDC ground support be able to provide additional help, even if marginal?
So I think I've addressed that question by explaining what the type of support that the CDC has to offer and the type of support that we need. If we want to increase our vaccination coverage, the CDC is not going to send people here to give shots. If we want to make strong connections to the community and understand the reason for their hesitancy, the CDC does not necessarily have a ground team that can help us with those kinds of trusted connections on the ground. And we are having to make a large number of calls. And so we are bringing in people who can provide the type of coverage that we need to make calls for symptom monitoring. That is not necessarily the kind of support that the CDC needs to send to the state for people who can answer the telephone. So we are tapping into those kinds of resources through our own means.
Thank you, Dr. Bell. And Baker? And Baker, you're muted.
Hey, I apologize. Dr. Bell, thank you again. This is Baker Maltz with the Spartan Mercurial Journal. At what point y'all reported a number of infections that were traced to a particular church, I think Way of Truth Church, and I believe it was 38 infections. Do you have a number of infections traced to any of the other churches where there have recently been exposures? Is that information we could possibly get? And I think someone put in the chat a question about whether the churches have still been cooperative, and so that would be kind of along the same lines as what I'm asking here as well. But yeah, a number of infections that might be linked to exposures at the churches that y'all have reported on recently.
Now, let me just offer a point of clarification. I would not say that we are tracing infections to those various sources. What we are reporting is that we have identified public exposures in certain settings, including churches. But when we also know that there are public exposures that have occurred in shopping areas, in community attractions and things like that, we cannot say for certain that someone got their infection at a particular setting. With the exception of households, makes it much easier to say we have a couple of people in this household who have the measles, and we have other people in the same household who are unvaccinated. There we can make linkages of sources of infection with more certainty. So I just want to be clear on what we're announcing is public exposures. We are not saying the case came from this location. And we do appreciate the cooperation that we have received from churches. Working with their church leaders, they have worked with us to identify the activities that they're having. The churches have, some of the churches have suspended certain activities that could put people at risk. They've stopped a certain, children's church or something like that. And so, yes, we are benefiting from the cooperation of those churches and those church leaders. It's been very helpful.
Thank you, Dr. Bell. And Deidre?
Hi, thanks for taking another one of my questions. So now that this outbreak is just slightly bigger than the Texas outbreak, I'm wondering if you have thoughts about the difference in hospitalization numbers. Texas ended with about 99 hospitalizations, and South Carolina, of course, is reporting 18. Do you have any thoughts about that difference?
I'm not sure if they had required reporting in Texas. And so here in South Carolina, the complications are not reportable. So these are sort of, we're making every attempt to learn about the complications of, particularly about hospitalizations. And so I can't make a comparison there because I don't know how they compiled that hospitalization data. And and without it being reported, even when we require reporting, we don't get 100% reporting. So we don't know if that is an underreport of the complications, not just hospitalizations, but we also point out that people are seeking medical care for complications of measles or illnesses that do not require hospitalization, but they're getting sick. And this is another reason we are having these exposures in healthcare settings, because people are going to the urgent care and going to clinics because they need care that doesn't require hospitalization. So we don't think that we're getting an accurate picture at all of how these illnesses are impacting our community.
Thank you, Dr. Bell. And there is a related question in the chat. Can you describe the 18 hospitalizations? What issues are you seeing among hospitalized patients?
So we can't comment on those specifically, but what we understand about the complications of measles is that measles pneumonia is a complication. Measles encephalitis is a complication. We know that longer term that the measles virus can attack the immune system and cause it to sort of lose its memory and its ability to recognize other infections. It affects those immune cell responses. And so we can actually see other infections that may not necessarily even be attributed to measles, but people are at an increased risk of other infectious diseases because their immune systems have been impacted by the virus. We know of complications during pregnancy, so that when pregnant women develop the measles, they can have complications. There can be early deliveries. There can be complications in the neonatal period. There can be complications of infections early in life that can result in birth defects. So those are what we know in general from all of our historic knowledge of how measles affects communities when we have widespread transmission. And so we're just not getting a picture of that now from these small number of hospitalizations that are known to us.
Thank you, Dr. Bell. And Lena?
Thank you for letting me ask another question, Dr. Bell. In the United States, we've had a lot of measles outbreaks that began in close-knit communities that were under-vaccinated, not just in South Carolina, but obviously Texas and New York and Minnesota and Washington State. In Washington State several years ago, they had a measles outbreak, and a lot of the cases were centered in the same kind of immigrant community as we're hearing about in Spartanburg. I was wondering whether you had reached out to other state health departments that had similar close-knit communities as in Spartanburg for any advice or strategies to deal with hesitancy and resistance to vaccination?
We have, and we have benefited from that. And that might be something that I would point to as an example of how the CDC has supported us from their experience with supporting through other outbreaks. And so how effective outreach has been, the means of outreach for sort of isolated communities. So yes, we are learning from that. And that is one of the examples of how that CDC expertise supports us from that subject matter expertise level, and not necessarily getting teams of the CDC on the ground to help support those measures, but it is their knowledge of how measles has behaved in other communities here in this country for recent outbreaks, historically, and in other countries. So it is that understanding that is, just as an example, because I've been asked that question repeatedly about support from the CDC, is they are helping to connect all the states that are experiencing outbreaks so that we can benefit each other from our best practices.
Thank you. And Carrie?
Hey, I had another question. Is it possible to say how many active measles cases there are? We know 89 were reported on Tuesday, 54 on Friday. So is it fair to say there's over 100 active cases? I mean, that kind of seems to be the theme every week, or would you be able to quantify that?
And not necessarily, because we define people during their infectious period. And so if somebody defined as approximately 4 days before the rash onset to 4 days afterwards. So wherever someone is in that 8-day period is considered to be an active measles case, and that can vary from one case to the next. People are rolling into that infectious category and people are rolling out of that infectious category on a day-to-day basis. So we can't give you that number from one day to the next.
Thanks, Dr. Bell. And Baker?
Yes, thank you. We understand that there are some fully vaccinated people who have become infected. Not very many, but among those, are there certain commonalities? If you can speak to that with those who got measles but have been vaccinated, are there any common threads there, age or gender or other conditions or anything that would paint a picture of that?
No, not specific to our cases. We do know that because the vaccine is not 100% protective, that we will see breakthrough cases. People who may have a weakened immune system or some underlying issues may be less likely to mount the strongest response to the vaccine. So perhaps it could be some of those people who have been fully vaccinated but nonetheless got the disease. So not specific to our cases, but that is part of our understanding of how we cannot get 100% protection for everybody that gets the recommended 2-dose series.
Thank you, Dr. Bell. And we've got a couple questions in the chat, and then it looks like we'll wrap up after that. The first is a follow-up about the churches, and I think you answered the first part, so I'll read this next part. They asked if there have been any attempts to do vaccine clinics at churches, and have church leaders been open to that, and have church leaders stepped up to be trusted messengers about vaccines?
We have had some church leaders reach out to us about holding vaccination clinics at either at their churches or that they would help promote. So yes, we are benefiting from that kind of support, as I mentioned earlier. And I'm sorry, was there a second part to that question?
Have church leaders stepped up to be trusted messengers about vaccines? Was that, or did you cover that? Sorry.
Yes, we've had some church leaders who have helped us with our messaging and encouraging people about the benefits of vaccine, encouraging people not to come to church if they're sick. And so those are all things that are helpful in reducing transmission in our communities from those leaders.
Thank you, Dr. Bell. And the last question we have is, how long has DPH made the South Carolina Certificate of Religious Exemption form available online?
We placed the certificate online within the last several months. Don't have that number, but I would say it's been available online for at least about 6 months to my memory.
Thank you, Dr. Bell. And it looks like that's all the questions we've had. We appreciate everyone for attending, and Dr. Bell, we appreciate you for taking some time to cover all these questions and being available to answer these. If anyone has additional questions, you're welcome to follow up with us via our media mailbox, which is media@dph.sc.gov. And without anything else, we will wrap things up. Thank you so much.
Thank you, everyone.